Hi guys, so today's video is going to be about what all career option a person has after completing their MBBS. Most of you only know about MDMS क्योंकि वही होता है वही people tell you only about NEET PG and I9 CET. ठीक है, so let's get into the topic. There are multiple options, okay, and the most easy and like जो सब प्रेफर करते हैं ज़्यादातर लोग विच इज़ MDMS. और MDMS इज़ नॉट ओनली ऑप्शन, यू कैन ऑल्सो डू DM and MCH directly after MBBS. Only difference between the MDMS and MCH DM is कि MDMS is of 3 years course but DM and your MCH will be of 6 years course. So what is DM, what is difference between DM and MCH, and what is difference between MD and MS? So all the surgical branches are called as MS, and all non-surgical branches are MD. Okay, you can do MCH or DM directly after MBBS, or you can do after completing your MS and MD also. Like if you have done MS, you can go for MCH, and if you have done MD, you can go for DM. Okay, or else you can directly enter through MBBS after MBBS also, but it will be 6 years course. Actually nowadays MCH and DM branches are like people prefer going to them rather than MD or MS. So most of the branches like general medicine and general surgery have to do MCH or DM. There is one more option which is DNB. DNB is similar to MD, but the only difference between MD and DNB is कि MD you do in a academic college where there is like proper college for MBBS and MD and MS, but DNB you can do in private hospitals also, okay, but there won't be much of academic exposure for DNB, but you'll have a lot of clinical exposure in DNB. And after completing either MD or DNB, you'll get equal treatment if you go for a job somewhere in the private college or government college. Okay, so it is also a good option. So this is about PG and residency in India. The second option will be you can pursue your residency in foreign as well. So we have 3 exams, like most famous here it is USMLE, PLAB, and PLAB is for UK, USMLE for US, and AMC for Australian Medical Council. Okay, so PLAB is relatively easy I heard, and it has 2 steps. One will be like first step will be your MCQ exam, and you have to go to UK for your second step, that is PLAB 2. And then there is AMC, which is little higher in difficulty. It also has 2 steps. First step will be your MCQ exams, which you can give online here itself, and second step you have to go and give the practical exam in that country. And then third will be your USMLE. Like most of you already know what is USMLE. It will have 3 steps. First and second step will be your MCQ. First step you have to give here, like first and second step you can give online here itself, and first step consists of your all preclinical, paraclinical subjects, and your second step consists of all clinical or your integrated type of questions. Okay, so this is how you crack first step and second step, and then you go and give your you are applicable for your residency there. But the most important thing about all this exam is you need to have a strong CV to get into the residency. So the third option will be your UPSC CMS or state UPSC, or your railway and other government jobs. So like you can get any government job through UPSC CMS, okay, any MO job. And actually when you go through UPSC CMS, it will be like settled job forever, like your lifetime. You'll get enough payment, and it is your government job. It is considered as government job. Okay, So you get into many railway or any oil and gas companies, so whatever we have in India, you can get there, and the pay is really good. You have settled life there, you'll have all the allowances there. And also in state UPSC. And um, then comes railway and other government jobs, which you don't need to give separate exam for that, you can just go give interview. But if you're going into some railway or this kind of thing, you need to go give interview, but that will not be your like settled job, it will be contractual. Okay, you'll have a contract of for some years and then you'll work there, and it won't be permanent. But after going through UPSC CMS, it will be your permanent job. So this is the difference between directly going to MO and going through UPSC CMS. And then this diploma degree. Diploma is kind of similar to MDMS. Diploma is for 2 years. You can do diploma in few of these branches like OBGY gynae, you have radiology, you have anesthesia, ENT, pediatrics, you have all these diploma degrees. And it is not considered as that great as MDMS, but you can, if you did not get a good marks in NEET PG, you can opt for diploma, NEET PG or INI-CT. If you did not get that much marks where you can get a clinical degree, you can just go for diploma. And if you like, after getting diploma, you can go for clinical practice also, like you can practice your own clinic, you can have your own clinic, and you can earn a decent amount of money. Okay, so yeah, that is about diploma degree. And after diploma, there is one more option, that if you do diploma and then go for DNB, so then you have to do DNB only for 2 years. Means you can do a diploma for 2 years, then you can directly go for DNB, that will be only for 2 years. Generally DNB is for 3 years, but when you go after doing diploma, you are going to DNB, that will be for 2 years. So in 4 years you will get a DNB degree. Then comes this non-clinical career options, which is MPH and CRA. MPH is related to public health and CRA is related to clinical research thing. Okay, so you can just go for these things. If you are interested in some kind of research and paperworks, you can go for it. And also, if you are doing all these things in decent college, in a good government college, you'll get a good stipend also. So yeah, you can go for it. And then there is one more option, which is MBA. If you are like kind of person who is interested in administration kind of thing, consultancy and these things, you can give CAT exam, and you will have an MBA degree, and you can go for hospital administration. And if you don't want to be in a medical field and do something else related to some other corporate and something, you can do that. So next will be obviously your own clinic or your general practice. You can always do that because you have your degree, which is MBBS. You can always go for your general practice, you can go have clinic, and you can work as a JR or MO in any of the college in India who needs MO or JR. And you just need to give some interview. Even in AIMS you can come give interview, and just you can join as a JR and work, and you'll get a decent pay also. And then at last, you can always go for medical content creation, YouTube or Instagram. You can always do that, but always know your limit. You should know that what you can say and what you should not say in YouTube. About the pay scale in all these things, why I did not say, because it varies. When you're working as JR or MO or MD or MS or any diploma degree, anything, whatever you do in India in any college, it varies with state. South, I have seen in South Indian colleges, they pay very less for MDMS also, but in North Indian state they pay more, and in government colleges they pay more. Private colleges they pay less sometimes, and even they delay your pay. And also if you're working in AIMS, you get even more pay. So these all things depends on which state and which college you are and how much experience you have. So these all things matters. So yeah, that's why I did not say about pay things. So thank you guys. And because I got this new apartment and it is actually very noisy, I had to cut a lot of times because यहाँ पे कहीं पे कुकर की सीटी बज रही है, कहीं ट्रेन जा रही है, कोई बच्चा चिल्ला रहा है, तो these things are happening. I don't know how will I manage, but I'm trying to manage. That's why मैं इतना जल्दी चीज़ें बता रही थी. So thank you so much. Bye bye guys.